Metformin is ibiguanide. It is used for the treatment of type 2 diabetes. Off-label, it is used for the prevention of type 2 diabetes, gestational diabetes, polycystic ovarian syndrome with anovulatory infertility, polycystic ovarian syndrome with menstrual irregularities, and prevention of ovarian hyperstimulation with polycystic ovarian syndrome. Testing should be considered in overweight or obese patients, which includes a BMI of greater than or equal to 25 or greater than or equal to 23 in Asian Americans, and those who have one or more of the following risk factors: an A1C greater than or equal to 5.7, first-degree relatives with diabetes, African Americans, Latinos, Native Americans, Asian American, and Pacific Islander, women who are diagnosed with gestational diabetes, history of cardiovascular disease, hypertension, HDL level less than 35 or triglyceride level greater than 250, women with polycystic ovarian syndrome, physical inactivity, and severe obesity.
Metformin is an anti-hyperglycemic agent that improves glucose tolerance, lowering both basal and postprandial plasma glucose with mechanisms different from other classes of oral anti-diabetic agents. Mechanisms include reduction in hepatic glucose production, reduction in intestinal glucose absorption, and increased insulin sensitivity, which improves peripheral glucose uptake and utilization. Metformin improves glucose utilization in skeletal muscles and adipose tissue by increasing cell membrane glucose transport. This effect may be due to improving binding of insulin to insulin receptors, since metformin is not effective in diabetics without some residual functioning pancreatic islet cells. Unlike the sulfonylureas, metformin rarely causes hypoglycemia since it does not significantly change insulin concentration. An important distinction in that sulfonylureas increase insulin secretions, thus making them useful in non-obese patients with type 2 diabetes, while metformin improves insulin resistance, a common pathophysiological finding in obese patients with type 2 diabetes.
Metformin is a medication that you take by mouth, and it's usually recommended that you take it with meal in order to reduce GI upset. Absorption refers to the transfer of the drug from the site of administration into the bloodstream. The bioavailability for metformin is 50 to 60%, and food increases the area under the curve by as much as 73%. Distribution refers to the reversible transfer of the drug between the bloodstream and the extravascular space. Metformin has a large volume distribution, so that means it will go into the tissues, and protein binding is negligible. Metabolism refers to the transformation of a drug caused by various chemical reactions to produce metabolites, or the process of making the drug suitable for excretion and inactivating it. With metformin, though, there is no metabolism. And elimination refers to the irreversible loss of a drug from the body, and with metformin, it is excreted renally 90%.
Some side effects that require immediate medical attention are hives, swelling of the face, tongue, or lips, feeling faint, lightheaded, or falling. Slow or irregular heartbeats can also occur, and you need to contact the doctor right away. Some side effects that are more normal that usually occur are diarrhea, which is the number one, headache, metallic taste, upset stomach, and flatulence. Also, low blood sugar can occur. Some symptoms are shakiness, nervousness, weakness, and hunger.
You should get your renal function checked before starting metformin. If less than 30 milliliters per minute, then you should not start this medication.
Metformin is also known as glucophage, Riomet, Fortamet, and Glumetza. It is used to treat high blood sugar. Treatment with metformin should be combined with diet and exercise. Metformin should be taken by mouth with meals at regular intervals. Do not take metformin more often than directed. If you think you have taken too much metformin, contact your local poison control or get to the emergency room immediately. If you miss a dose, take the dose as soon as you can unless it's too close to your next dose, and just take your next dose. Make sure to bring a list of all your prescription medications, over-the-counters, and herbal and supplements, medicines to your doctor and pharmacist, because metformin can interact with some of these medicines. Do not take metformin with contrast mediums given before procedures such as x-rays, CT scans, or MRIs. Always carry a quick source of sugar such as hard candy or glucose tablets in case you experience low blood sugar. Let others know that if severe symptoms such as seizures or comas occur, to get medical emergency help immediately. Store metformin at room temperature away from moisture and light. Do not store it in the bathroom. Keep out of reach of children and pets. For long-acting formulations of metformin, it is not abnormal to see the shell in your stool and is not a need to be alarmed.